Talked to a lot of patients that suffer from TMJ. And if you've never suffered from it, it's hard because there's really no one out there that specializes in it and no one that can just be like, oh, this is what's going to help.
Yeah, and I think the reason no one specializes in it is because it's so difficult. Amy got to the point that, she had tried everything and spent thousands upon thousands of dollars getting nowhere. And that was the frustrating point. We would have spent whatever it took to get her better.
It was extremely hard on our marriage. A lot of the medications I was on blunted my emotion. We fought a lot, probably because I was in so much pain too. I would have done anything to get it to calm down. But it took years to kind of figure things out. Now we have some solutions.
Yeah, that's been pretty amazing.
Welcome to Look Good, Feel Good with Matt and Amy McKinley, the podcast where we bring you expert advice and honest, real talk on health, wellness, and feeling your absolute best. From hormone optimization to aesthetics and everything in between, we're here to help you live your best life. Let's dive in. Welcome back to Look Good and Feel Good with Matt and Amy. I'm Amy.
Howdy, I'm Matt.
So today on this episode of Look Good, Feel Good, we're actually going to talk about stem cells for the treatment of TMJ.
Yes, this will be good. You want to see this.
It's kind of the solution I wish I'd have had, about 10 years ago when I suffered with TMJ. And we'll kind of get a little bit more into that as we get into this episode. But, if you've ever dealt with chronic jaw pain or, headaches, popping jaw, clenching, grinding, it's one of those things, it comes on and it just takes over your whole life. It can be really draining. Yeah. TMJ affects more than just your jaw. It affects your ability to sleep, eat, and even focus during the day.
Yeah, we had this happen personally to Amy, and it affected her for years. And it was super difficult, super frustrating. We found some quicker solutions that have been amazing for folks.
My story with it about 10 years ago, I remember waking up one day and I felt like I had a sinus infection or something. I just hurt. And I just remember thinking, okay, I've got a sinus infection. I never really had a sinus infection. But so I called in some of my own medications for me, of course, just trying to fix it. And called my own x-ray in to see if that's what I had going on. And I went and saw multiple ENTs, ear, nose, throat doctors, trying to figure out what was wrong with me. And I was desperate. I'm not going to lie. It was kind of one of those things where I was just desperate to find relief because I was in so much pain. It affected every aspect of my life.
And I was super frustrated because I was trying to figure out ways I could help her with my medical background. And it seemed like we were in this vicious cycle of nothing working, more frustration. It actually was a kind of a tough time in our marriage for a year or so.
I mean, I went on medications that made me a different person. I went on some Balta, and I was on multiple.
We don't recommend that for anybody, by the way.
It didn't work well with me, but I remember just feeling very numb. I didn't care about anything. It just made me not care. But at the same time, I was willing to do anything to get out of the pain. And I went and saw some specialists for TMJ that put in some appliances for me that I wore. It did help a little bit, but nothing really helped. And it was very frustrating. And I've talked to a lot of patients and a lot of women that suffer from TMJ. And if you've never suffered from it, it's hard because there's really no one out there that specializes in it and no one that can just be like, oh, this is what's going to help.
Yeah, and I think the reason no one specializes in it is because it's so difficult. Amy got to the point that, she had tried everything and spent thousands upon thousands of dollars getting nowhere. And that was the frustrating point. We would have spent whatever it took to get her better. And we were just in this freaking vicious cycle that never seemed like it was ending.
Yeah. And I remember going on the University of Utah, having surgery, even I was willing to do anything just to get my life back and just to feel normal again. And it was extremely hard on our marriage. I remember it really affecting us because a lot of the medications I was on blunted my emotion, and I didn't care. We fought a lot, probably because I was in so much pain too, and the medication made me feel just indifferent. But a lot of women come into my practice now and they'll talk about it, and I'm like, and I know what kind of brought it on. I know it was stress. Looking back, my mom was sick. I had taken in my sister who had special needs and trying to get her situated. And looking back, I was working full time. I had 3 little kids. And here I am, superwoman, can do anything. And I just remember thinking, it just came on very quickly. And I just didn't have time not to feel good. And it was very frustrating to me. And like I said, I would have done anything to get it to calm down. But it took years to kind of figure things out. And now I know kind of when it's coming on, I know what to do. I do a lot of breathing exercises. I know it's stress related. But now it's kind of in our field now. We have some solutions.
Yeah, that's been pretty amazing. The solutions are way cool.
I know if I would have known about stem cell therapy, back in my day, it would have been so nice to be able to speed up the healing process, and it would save me a ton of stress and a ton of money because I did everything from surgery to appliances to chiropractors to massage, all of these different things. And I've had a couple of patients come in that have had TMJ, and I've treated them with Botox because I know Botox works to kind of help relax the muscles. And that's kind of what all I've been able to do is, but let's talk about the TMJ joint, where your jaw connects to the skull. It's used constantly. It's actually the strongest muscle of your body. Like I remember reading the Guinness Book of World Records where the guy pulled the truck with his jaw muscle, like bought it and pulled the car.
A semi truck.
Yeah. And it's like, because that is the strongest muscle in your body is your jaw muscles. And I remember thinking back in the day, like my muscle was so tight, I couldn't relax it. And so anyway, most treatments focus on like Botox, may help for a short time, but it doesn't repair anything. It just is a fast solution. It helps temporarily. Let's just put it that way. Night guards, we use a lot of night guards to help the joint to kind of help relax. And anti-inflammatory meds, only go so far. The stem cells are different. They help reduce inflammation. They help support repair and, in the joint. And when you treat the source, not just the symptoms, then that's when the real healing can really happen. So, Matt, you've handled most of our orthopedic stem cell injections, knees, shoulders, backs, What do you see as the difference when you're talking about TMJ?
So TMJ, we all know it's been frustrating. So I had a patient that came in and she had a stem cell injection in her shoulder and it worked phenomenal. And she was telling me about her TMJ and I said, why not try stem cells in a TMJ? But I referred her to Amy because Amy has injected the TMJ at countless times with Botox and other things that help temporarily. But we thought, why not try stem cells? So I sent her over, and within a week, she said, oh my gosh, my pain is 100% gone. And she gave me a hug. I go hug Amy because she's the one that really did this. But, it's cool to see how stem cells can help so many things. The TMJ, it's unlike a knee or a shoulder where if you have a shoulder or knee, you can rest it, right? You can relax your shoulders or stop walking if it's your knee pain. You can do something to at least get some relief. With the TMJ, you really can't. So it's unlike any other joint. And these results that we've seen now have been really phenomenal. So what the stem cells do is they really reduce the inflammation. And that's the biggest thing. The inflammation is what's causing the pain. So you get the inflammation down, you're a pretty happy camper right away. But the difference between what stem cells do and other treatments, they not only decrease the inflammation, they support the healing response. So not only are you reducing the pain, but you're getting this healed. And it can actually rejuvenate or regenerate cartilage and other tissues. So we've seen patients now that haven't responded to Botox and other things do phenomenal. So Amy, if you saw a patient with TMJ or they have it, how would you start this whole process?
So we first bring them in, and a lot of times they already know they have it. I mean, they've been told they've had it. They suffer. I mean, a lot of them have headaches, some vertigo, some ringing in the ears. And there's a lot of things that kind of go along with TMJ. But we first bring them in for a consult. We kind of go through it, kind of discuss kind of what TMJ is and what therapies they have done. Because a lot of times they've already done a lot of therapies. A lot of us people that have suffered from it, we've gone to multiple doctors seeking help. And so we just start with a consult and, we find out how long it's been going on. We talk a little bit about stem cells. We talk a little bit about what they are, what they're not, and what they are. And yes, we use mesenchymal stem cells, which are umbilical source stem cells.
And yes, they are They're fine to use in the U.S. You don't have to go to Mexico or Panama.
Yeah. Or what was the other place?
Oh,
The Caribbean.
Antigua.
Yeah,
Yeah,
Antigua.
countries all over the
Aruba,
world.
Antigua. Okay, so the injection is really quick. I actually put a little bit of lidocaine in with my injections just because I think it helps with the process a little and numbs it up. But it's done right in the clinic. You know, it's very quick. You get pretty quick relief too. Like within a week, your symptoms are much better. I call all my patients back up after we do it. I find out how they're doing, and most people are feeling good within 1 to 2 weeks. Sometimes there's a little rebound, but then it gets better. And I always bring that back in around 2 months, and we discuss whether a second treatment is warranted or not. And it's been crazy to see the results with our TMJ patients, just having no other options and being able to give them their life back because I was there. I was there. I remember how hopeless.
And I remember it was brutal. It was so frustrating. It's like, oh my gosh, what else can we try? Nothing has worked, and it just seemed to be getting worse and worse.
And I remember calling my brother, who's an endodontist who works in, this dental field, and I thought maybe he could help me out. And, he gave me a few options about a doctor over in Texas that specializes. And I was even thinking about flying out there to get someone to help me. And you get pretty dang desperate. I remember even kind of getting into this little thought process of, this is kind of crazy, but injecting my own pterygoid muscle, which I found out every little muscle there is in the joint, in the jaw joint, because I, experiencing this pain. I was like even thinking I could put a needle back in my ear.
Oh yeah, your brain starts going
into
through
a place where like you're desperate for relief, you're desperate for help, and you will do anything to feel like yourself again.
So what would you describe as some of the results that you've seen after these treatments with your patients?
I'm not going to lie, I was a little skeptical on whether stem cells would work or not for TMJ.
I was too. We had never done it, and I was like, why wouldn't it work? It works in other joints, so why not the TMJ?
So I did it kind of thinking, okay, let's crossing my fingers, hopefully this works. And I called my patients back, and they, after about 2 weeks, just kind of give them some time. And wow, their experience kind of blew me out of the water, to tell you the truth. I did not, I was kind of hoping, like crossing my fingers, like, oh, hopefully they've had some good relief.
Maybe it'll help a little bit so they're just not in extreme pain.
Each one of them has had relief, and it's been amazing. Like all I can say is almost miraculous in that, like, I wish I would have had this when I was going through the pain and suffering. And it was a whole, maybe a year and a half of not being myself and searching for answers. So I'm so thankful that this is around now and we're able to offer it here at our clinic and to give people hope and relief, because not a lot of places do this. And I think, as far as I know, we're the only clinic that uses it for TMJ. I know there's a lot of clinics that use it, stem cells for other things like, the joints and other things, but not for TMJ.
Yeah. So, from my perspective, of course, my background was orthopedics prior to this. So these people that come in are oftentimes at the end of their rope. But what we want to do is get to people before they get to the end of their rope, because they don't need to suffer this long. I've watched Amy now help several patients see almost miraculous relief. And I'll be honest too, I didn't know what to expect. I've seen it work so well in other places. I just wasn't sure, because TMJ can be so hard, but so far it's been pretty amazing. And these people are so grateful. And that makes us just feel wonderful that we can help them. So it's exciting to see how stem cells are helping people beyond the, normal joints that we think of, like shoulders, hips, knees, ankles, backs. Now TMJ is coming into place. And I think this can be game changing, literally, for so many people. So if you're struggling with TMJ and you feel like there's no hope, you do have hope. You don't have to be in pain every day. Stem cells may be your solution.
I reiterate what Matt just said because I've been there. I remember thinking about never getting better and just having that no hope. I just so hopeful now that we have actual treatments out there to be able to help people and real results.
Yeah.
And I just think,
Jinx, you owe me a Coke.
I just think it's exciting. Like I say, I wish I would have had this knowledge and the options to be able to do stem cells back when I was suffering so bad. Pass this along to people that are suffering from TMJ, or have these chronic headaches, chronic dizziness, chronic pain, and don't know where else to go. I mean, we've really helped a lot of people.
Yeah. So, definitely share this with anyone you think might benefit. That, like we said, we don't want them to be at the end of their rope. We want to get them before they're in, and not have to struggle so long. Yeah. No one wants to struggle.
Yeah. So thanks for listening to us, and we'll bring some other episodes to you. If you have anything that you'd specifically like to listen to or for us to talk about, please let us know. Drop it in the comment, and we'd appreciate it. Thanks, guys.
Thanks, and we'll see you next time.